Hello doctors, students of homeopathy and friends of homeopathy. Today is the 1940th day of uninterrupted daily webinar of IFPH. Today our guest speaker is Dr. V.K Karunakar. Let me introduce him. He is a medical officer, Government Homeo Dispensary in Nellore. He is a former assistant professor in Government Homeo Medical College, Kadapa. He is a senior consultant at Karunya Homeo Care, Kadapa, Vinayaka Homeo Wave, Hyderabad, Yashodhara Homeo Clinic, Nellore. And Dr. Karunakar have more than 14 years of clinical experience. Today, our topic is my experiences of homeopathy in management of pregnancy. Let us welcome Dr. V.K. Karunakar for this session, and I welcome you all for this session. Let me make him the co-host.
Yeah, very thankful to everyone who have participated and giving this opportunity, and very interestingly or eagerly participated for learning process continues. It is 140th session. So today I would like to present my experiences with homeopathy in management of pregnancy. So in every human being life, so especially not only it is pertaining to the women's, it is a part and parcel of enjoyment event in men also. So, but both. Why? Because without participation of both, it is a combined activity of male and female. So, to produce their generations, a life they have given to born or live to other. So, this is a very, very happy. Even we are waiting for endless. We are not specifically designated how much time per year. So, in present scenario, it is a parameter for the qualitative life to anyone. So it is a very controversial and very interesting topic in present scenario. Why I am mentioning a controversial means in the present scenario, there is a reducing the fertile rate. So the fertile rate, even fertile, they are conceived. So there is no guarantee for live providing a live child till the parturition process. So many complications, so many things are happening. So they may cause also for depression, or so many disease conditions are happening in the mother and in the family. So it may leads to sometimes there is a low status in the family, leads to commit some suicidal or some other tendencies also in the families because of lack of children's. And there is a diversity, divorces are there is a possibility of divorces in the family because of the lady fails to conceive, or the gent fails to provide a conceivable capacity. So the conceivable capacity is also a parameter in present scenario. So not only in the promoting in this aspect to remove the infertile causes of infertility, and for succeeding the pregnancy and management of pregnancy is a very, very challenge into homeopathy. Why? Because the modern medicine people are not allowing to use homeopathic medicines in the present scenario. So even our homeopathic persons also who are qualified, they are also not interested to use our homeopathic medicines. Personally, what I have observed in my family also, the certain things are restrained, even though good therapeutic agents are there in homeopathy, but we are not completely enjoying the fruits of homeopathy with in the cases of pregnancy. So here and there some people are succeeded, and some people are come to use interestedly come to use homeopathic drugs, but we are not 100% success rate in this aspect like some other cases. So why? Because so many reasons we will discuss. So it is a challenging event without coordination of the allopathic people or other things. So we are unable to manage. So somewhere the lack of awareness is there. Somewhere the gynecologists are completely restricted. They are, should not use any other drug during pregnancy. They are creating some sort of fear. It is a very moral and sensitive issue. Whenever once they have developed fear or bad experience by using our homeopathic drugs, they never come forward. And also they are insisting to others, so don't use homeopathic drugs. Something happening bad in our lives are like that they are. So we know very well the bad is propagating very fast and quickly compared with good results. but no one has succeeded 100%. No science has existing on earth. Success rate is 100%. Many deaths were happening because of faulty techniques, because even applied skillfully certain techniques or drugs in management of pregnancy, but they never consider. Even some event happening by using our homeopathic drug, it is not endangerous to the life of mother and baby, but it was propagated by using our homeopathy. So many things are happening. So it was spreading. Even the qualified persons are also not dare enough to showing interest to use our homeopathic drugs. So what I have observed personally, these are the things. So that's why today we have learned, I have shared my experiences in treatment of management, treating pregnancy cases. So what is the need of using homeopathy in modern scenario or in pregnancy cases? So the keywords are homeopathy. So why I used therapeutic nihilism here means even though homeopathy is a good science, but so many great remedies. If you study Materia Medica from aconite to ginkgo metallicum, in the most of the drugs, every drug has its scope in certain issues of pregnancy. Either it may be a headache, either it may be indigestion, either it may be a constipation, either it may be a fear, anxiety, or itching in various genital parts or all over the body, or some other areas, so hemorrhoids or hair falling or some other acne, indigestion, food aversions and intolerance, desires and cravings, especially in the sexual aspects also. So many confusions are there in the public, and so many issues are mentioning under each and every drug. When you have thorough study of Materia Medica and understanding, thorough knowledge of in repertory aspect, so when you are understanding the patient, very easy to success in homeopathic point of view. But we are not enjoying the fruits of homeopathy. So that's why I have to mention therapeutic nihilism. So as per therapeutic nihilism means everybody knows homeopathy is a good science. So many therapeutic agents are there for management of pregnancy, but government has given a right to managing your alone a pregnancy cases, but gynecologists are not allowed to use homeopathic drugs. Even few people are come interested, so because of some bad experiences or some homeopathic people are giving some wrong guidelines to them, so they are also far away to the use of homeopathic remedies. These are the facts I have observed in many patients, nearly that one. So the pregnancy event is so excited. So in every human being life, so everyone is waiting after marriage. So whatever the which one is gives more happiness to the human beings means after conceiving. Once we have to conceive, it is a quality of both life, human beings' life. So when fails to that, there is no quality. And also, so many changes were happening in the minds of the human beings after conceiving or after getting a child. So the love and affection developed. A third person come in between them. So they want to show before they haven't such type of behavior. After getting a child, they both are changed. They are showing their showering their love and affections towards the child, and it causes there is a beautiful environment in the family, all other things. So here the first of all, so what are the pregnancy is defined as the period of time from the implantation of ovum in the uterine cavity until or till the delivery, or it is so many changes that takes place in the fetum and come out as a beautiful baby or whatever the baby. So here so many things are happening. So the physiological changes or psychological changes. So some people are attained normal phenomena, some people are developed abnormal phenomena, and so many pathological conditions are there. So the pregnancy is not a simple task. It is looking like a simple one, but everyone has experienced some issues. Either it may be a common issue or a serious issue, or it is a pathological one. So everyone has experienced. So a little bit they are feeling discomfort after conceiving that one. So a few people are very easily attain that full term and easily delivered a good healthy baby. So their enjoyment is very, very, and we can't measure that type of enjoyment. But few people are struggling. Even so many conditions are, so many obstacles are developed, are facing, but they are ultimate, they are reaching, so they are deliverable. A few people are moving to that. Nowadays the fertile centers are developed more advanced technology, so many people are moving. So even till now, as per global norms, so more than 30% of people are not having conceiving capacity. Even governments has afraid, so they are promoting, keep all the things works away from that one. First you have to involve, you have married in a right age, and to give a birth to child. You see, it is the norm of government in the present scenario. You have to understood. Even after that one, there is a difference in the sex ratio also. So why? Because even they have conceived, so a few people are habitually they are aborted. So say so many difficult hurdles or talks are there. So that's why here there are normal presentations are there, abnormal presentations are there. Those people who have attained a normal labor, they are more happy and enjoying without it's a very impossible to attain or reach that stage without feeling, without facing any hurdle or other thing. So sometimes some people are, even after pathological labor, they are showing that one. So that's why here, as a homeopathic man, we have struggled a lot in treatment of or managing the pregnancy cases. Why? Because they are not come straightforwardly to us, and even some people are having interest because of restrictions. They are not giving any chance to that one. So that's why the homeopathy has good therapeutic agents or remedies. In my experiences, I have faced so many bad things to come forward to using our homeopathic drugs. So even we are creating awareness, but they are not. So, but most of the cases, every homeopathic doctor has treated in these common issues of pregnancies. What are the common issues of pregnancy? Morning sickness, indigestion, and constipation, fatigue, or back pain, emotional disturbances like some few people are anxiety, or few people are having fear and depression. So they are looking like a physiological one, but when they are increased or heightened manner, they are present in the economy or human body. So there is a need of treatment. Generally, there is no need of treatment, just awareness or health education is enough in these aspects. As per homeopathic norms, we treat it as indisposition. These are all indisposition. Either it may be a morning sickness. It is a commonly resulting in each and every human in after conceiving. So because of hormonal disturbances, here no need to explain the mechanisms, the production of these symptoms, all other things, but little bit. So these are all the common elements. If you see in every drug or in repertory, each chapter, so there is a pregnancy existing as a sub rubric. So suppose nausea is there under the stomach, nausea during pregnancy. So backache in extremity, back region, pain in lumbar region during pregnancy, or pain in extremities during pregnancy. So like that pregnancy existing as a sub rubric, if you see a Kent repertory like that. So many rubrics, nearly almost more than 50 number rubrics were existing in the Kent repertory. So for each rubric is separate one, and each one has its own remedies. So every homeopathic doctor has treated these cases as per symptomatology. So by looking like indigestion towards which food items. If you go to in Metrimedica or repertory, each food item intolerance or desire or any other ailments which are resulting because after taking this food item, there are specific remedies are there. If you are giving that one, so here one more thing is there. If you for these complaints, any person consulting a modern medicine or other field of therapeutic methods, what they have suggested, so don't take those food items. You have restrained that one. They have prescribed more number of vitamins or other proteinous food items or artificial food items. So they have given some antacids or according to the symptomatic certain in certain cases painkillers are restricted. So that's why they have advised to bear it. So in certain aspects, the other medical professions are not having sufficient medical or drugs or therapeutic procedure to treat or to nullifying these agents. For example, anxiety. So in a case of anxiety, what is the common treatment of allopathic mode? So there is a sleeping tablets are more given. If you are habituated to take sleeping tablets, but they are contraindicated in pregnancy, even fear and depression. So that's why they are almost suggested there is a bear it and you have habituated to educate more and don't sit alone like that. But as come to the homeopathic man, so for every disease, anxiety during pregnancy, depression during pregnancy, there are number of medicines for there. Aconite is there, lycopodium, lacasis, or gelsemium, or digitalis, or whatever. So many remedies were available as per the fear or as per expression of the fear and anxiety in the person. You are constituting a totality. You have prescribed the remedy. Here, not only removing that symptom, either it may be indigestion or constipation or fatigue or back pain. So the body has developed resistance or adaptiveness to that particular ailment, even after exposing that one. That was the beauty of our homeopathy. In many cases, I have observed, not only in pregnancy cases, in general cases also, what I have observed, after using homeopathic remedy, the other medical therapeutic drugs were act more quickly and providing good result, and the patient has developed that resistance or adaptation to the existing cause without feeling any difficult. That was the beauty. So similarly here that. So come to the common illnesses are treated. Many drugs were there. Aconite, arsenic album, simsipiga, whatever, pyrogenum, arnica, gelsemium, calcareous, like that. So everyone knows this drug. No need to explain like that. So a little bit I have to share my experiences. Coming to the pathological conditions, here is also, it is a biggest question in every pregnant lady. So the modern medical men are prescribed vitamin tablets and iron tablets and calcium tablets. So number of tablets which are related to the minerals and vitamins. Is it essentially, really you have to ask, you question yourself, the vitamins are essential for that one? Yes, definitely during pregnancy, there is a additional energy is required for baby and mother. So there is a need of extra amount of energies. But why you have not suggested to take? Generally, what is the required real indication for prescribing these vitamins or other things? When patient is unable to eat, then only how to prescribe. The first question the patient asked, anyone comes to homeopathy one, or in my experience, most of the patients were raising question, I have to use these vitamins or not. Madam has written this one, folic acid tablet and vitamins tablet. In addition to that, in present scenario, in most of the cases, they have to prescribe progesterone supplementation. Progesterone supplementation. Either we have to continue or not. This is first question. As a homeopathic man, so as per our principle, you should not allow anything during our treatment. So it may be spreading as fabricated, manipulated, then should not use any drug while using homeopathic drug. But it is not a right statement. Whatever the drug you have to use it during usage of homeopathic drugs, what is the need? There is no need of such a drugs. Why? Because our homeopathic drugs are more effective in the managing these ailments. So that's why you should not use. This is the original statement, but most of the people are misunderstanding. They are not come towards us also. Why? Because you should not use any other drugs, or other drugs are doesn't work after using homeopathy. Such a type of misnomers or misconceptions were existing. So, but it is a wrong. So here, as a homeopathic man, I advise it to my patient to take a rich containing, iron containing and vitamin containing diet first. If you are unable to eat, then you have to take the vitamin. So even in our homeopathy, so again, there is a second question. Is it any vitamin substitutes are there in homeopathy or not? So really there is no substitutes, such type of vitamin substitutes in homeopathy, but the biochemic salts were act like some up to some extent. It act like a substitute. I have to prescribe. For example, iron deficiency, ferropas is there. B complex deficiency, calcarea pass is there, calcarea floor is there. These tissues also are, magnesia pass is there, calipass. Calipass is a very good remedy to promote the sleep pattern in a pregnant lady, to remove the anxiety and fear, and also neurological irritability is reduced. I have observed in my experience. Parampas to enhance the iron absorption from the gut and they promote the synthesis of iron, hemoglobin percentage, through which there is a maintenance of adequate higher hemoglobin and RBC content in that one, through which so many consequences are nullified. So, like that. So, whenever they are unable to bring, or I have conducted experiments along with iron tablets, our treatment without iron tablets, all folic acid tablets, all other things. So, I have strictly restrained whoever believing me as a my personal means my wife and some my relatives, all other things. There was no changes. So, but here one more dangerous is when you know, or this is a known by the gynecologist, they are scolded to the patient. So that's why most of the times when we are acquaintance with the gynecologist, very easy to show our therapeutic action. So it may be there is no need, but you have to advise the diet, or there is no nothing wrong. You have added the supplementary nutrition like vitamins along with our homeopathy. Even another pathological conditions are hypertension and preeclampsia, eclampsia, diabetes, and STDs, developmental defects in the fetus, low birth weight. This is a very, very important one, the developmental defects and low birth weight. In the most of the time, even premature deliveries also sometimes. So there are so many drugs we have to study. This is the drug of choice to premature delivery. This is the drug of choice. There is a developmental defect in the baby. So many, either maybe congenital hernia. If you read Magmore, there is a congenital hernia is there. Similarly, congenital hydrocele is there in the baby. So the if you are identified such a family history in that one, if you are treated those individual as miasmatically or constitutionally, or such drugs were administered either according to the need, those as determined by the family history or the susceptibility, how to administer, definitely 100%, we have to restrain or to nullify those consequences in that family. In my experience, I have observed the most of the things up to the sixth period, at the end of fifth month, TRIPA scan reveals either baby condition is good or not. So that's why in early months of pregnancy, that means antenatal care, whoever have family history, you are administered our miasmatic remedies in the first, second, third months. So I used later on, I will show my table, which one I have to follow in my cases like that. So definitely, except 10% cases, 90% of cases, there was no malformation, there was no abnormalities, especially low birth weight or developmental defects in the baby. So such a beautiful therapeutic action were existed by our drugs when you are administered to the pregnant. And also in hydramnios is also, but not commonly seen. These are all hydramnios, either polyhydramnia or olighydramnia. So they are showing during which there are so many consequences are developed not only to the mother and baby also. In my experience, there is a belladonna, apis mellifica, and arnica, calcarea car. So these are the drugs were used, bryonia. So very, they are exerted wonderful action to balancing that amniotic fluid. And antimonium tart also, whenever the low level of amniotic fluid is there is a chances to, so baby is asphyxia developed in the baby, and because of maternal hypoxia. So the hypoxic condition leads to the death. So in my experience, even premature delivery, those individuals are having less amniotic fluid. They are underwent a C-section, cesarean section. The babies are born. So there is a chances to develop in that baby hypoxic ischemic encephalopathy, HIE, hypoxic ischemic encephalopathy. Antimonium tart is worked wonderfully immediately after born. So many people have doubt either immediately after born, either we have to use homeopathic drugs or not. Yes, definitely we have to use. Many homeopathic physicians have doubt how to administer. In allopathic people, they are giving drops. So a few people are there, they are directly administration of the drugs on them, but it is not a right methodology. Only in that skin is also one of the important route for administration of the drug. You have to administer antimony tart on the back of the hand. You have rubbed the one drop on the back of the hand or on the forehead. Here the skin is very sensitive and there is a facilitating absorption to that one. So immediately they have developed the cyanosis is reduced and baby started the crying and passes the stool or meconium is there, or in such a conditions the antimonium tart is. Why? Because it is a very good drug of choice to the drowning. So the baby is under amniotic fluid, is a drowning state. When come to outside in the field, immediately unable to take the deep breath or a thing. In those cases, the baby or newborn baby feels difficulty. You have to administer one drop of antimonium tart immediately. It gives very to promote the respiratory action, cardiac activity, all other things. These are all. So in a case of abortions, hundreds of remedies were there in our Matra Medica for different types of abortion, either habitual abortion, threatened abortion, whatever, septic abortion. So different types of. So if you read your Matra Medica thoroughly, or what we call in the repertory as month-wise, it is a remedy choice of Viburnum aplis is there, first month abortions, and CKL sabina is there, second and third month abortion, Apis mellifera is there, third month abortion, Simsifuga is there, fourth month abortion. So like that, every month abortions are there. In my experience, why I was surprised the exerted action of homeopathy. So a 36 years lady is unable to conceive. So our gynecologist she underwent a fertility clinics, all other things. Their ultimate decided, so you should not went to a conceivable process. Why? Because you have developed so many problems are like that. Why? Because she is a known patient of hypothyroidism or a rheumatoid arthritis positive patient. So she was developed a very depression because of received such a type of statements from the gynecology or modern people. So she has consulting me not for the conceivable capacity to reduce her rheumatoid arthritis, all other ailments. So she has expressed this one. So I assure that lady no problem. And also one more, age factor is also more important. 36 years you are attained over age. It is not the right age for conceivable conception. So that's why. So she has developed depression. I treated that case. So the rheumatoid arthritis has completely came to negative, and whatever the other issues are lessened, and she has conceived. She has conceived. So she strictly stated her gynecologist, I used only homeopathic treatment during man. She has asked me either fully you are able to manage my case with fully with homeopathic drugs or not. Yes, definitely I have managed, but you take the help. Why? Because I am not having knowledge, even though I have knowledge the studying of scan reports, I am not having such equipment. Every month you go and consult your gynecologist and you have take a permission from the gynecologist, and I used many medicine. You should not use any drug. Like strictly I have instructed that lady, and whatever the table I want to show later, I have followed that one and I have given. So she has developed everything. Gynecologist has given a right reports according to every month. Everybody is feeling very happy. But all of a sudden, in 8th month of pregnancy, 8th month of third trimester, she has developed bleeding from her vagina. So the gynecologist has prescribed so many remedies for her and advised to admit in the hospital and administered so many therapeutic agents, but bleeding was not controlled. So she has again went to a depressive state, and she has consulting me. This is the situation. What I can do? The gynecologist advised to abort. There is a chances to die. The baby die inside of the womb like that. So I was struggled. Why? How I can prevent this one? So many drugs were there. So but attain age is 8th month like that. I opened repertory in the the 8th month. There are so many difficulties. Whether especially bleeding in 8th month, opium is there. So in repertory, opium is there. and also I have a little bit idea. So I have given opium to that lady to take every hourly for 3 hours, and later on every third hourly for 24 hours. Within 24 hours, your condition become a normal. You have to stick on to that one other. So in presence of allopathic gynecologist, she has taken those drugs, opium drug. So within 6 hours period, the bleeding has stopped completely. The gynecologist also surprised what you have used like that. She has stated, I already used one. So the baby has developed normal condition. Everything is not good. She has delivered till the attainment of ninth month. She has delivered completely a male healthy boy. So he is maybe attained age of 15 years now. So 15 years. So this was very, very important case in my experience. So entire period of pregnancy, she has under the homeopathic treatment only with the permission of gynecologist, with the permission of whatever the issue has encountered, she come and consulting me, I have to prescribe and supervision by gynecologist. So this is very, very important. After during baby age also, baby has developed comparatively few symptoms, but so most of the timing after attainment of 36 years there is no possibility of pregnancy most of the thing. One more case is also like that in my experience, but really she has one boy earlier. She is not came to the treatment of concept or pregnancy purpose. She has some other health issues, thyroid, similarly thyroid issue is there, and she has irregular periods, and she is not underwent a sterilization family planning operation. She was used homeopathic drugs. After using homeopathic drugs, she has developed a regular cycles. So I used that. There was no symptom at the time of consulting me. I used calcarea carb. So one statement is there. If you go and read Kent Metra Medica, so calcarea carb is a very good remedy for regularizing of irregular cycles after regular cycle. This is the thing. In the cycles also different patterns are there. So that statement was there. So initially, without any symptom brought into me, any patient, I used calcarea carb as well. Most of the cases I have succeeded. So after administration of the calcarea carb, either development of few indications for prescribing another remedy for those individuals, or he has those patients are have developed menstrual cycle, other things. So she has developed menstrual cycles and she has conceived. So after a period of time, again she has stopped her cycles. So he was come to me and stated that one. I never thought of pregnancy in that in case of that lady. I advise her to go and take a scanning scan report. What happening, we will see her like that. So it is a unfortunate, fortunate thing to her. She has conceived. So a third 16 weeks of gestational age baby was there inside of the fetus, and they stated that so there is a little bit thing is there, so they are advised to abort. So she came to me and asked what I can do. No need. If you want to a child, please keep aside. I have treated, no problem at all. If you don't want to child, you go to the abortive process like that. Yes, sir. We have to stick on to. We want to stay. We want to enjoy that second pregnancy also. Our age is 38 years at now at the time, and she is a known patient of hypothyroidism and anemia is there. So I have treated that patient for a period of time, so there was no issues. But again, in the sixth month or seventh month, in both day months, she has developed bleeding. So similarly, I used my table to her lady patient. So she again they are insisted no need. There is no need to continue this pregnancy. If you are continue, there is a dangerous to your life or baby also like that. Many times they are insisted because of high level of thyroid. I advised to take allopathic drug also for supplementation, thyroid supplementation along with my drug. There is a possibility to control your thyroid values. So later, after delivery, we will see, we will reduce your thyroid dose like that. So she has listened that one, and she used allopathic drug along with our homeopathic drugs. In here is also I used opium for to prevent that bleeding tendency at the 7th month. So definitely, very good result is there. He has delivered a normal baby. Even it is a normal delivery. This is also very fascinating to learn, very happy even to me and other things at the age of. So that boy age is about 7 years now. The boy is very. She stated to me, she was under the first pregnancy under the vision of allopathic care, second pregnancy completely under the supervision of homeopathic treatment. So there is a lot of differences there. So not only herself and the in the baby conditions, in the facing environmental situations or IQ levels, all the developmental things, all comparative. So similarly, this statement was observed. I have received many patients whoever having first pregnancy under the supervision of allopathic care and the second pregnancy is our homeopathic care. So there is a lot of difference in the behavioral pattern, all other things. So there is a need to confirmation. You have to conduct more experimentation on this matter. So for prevention of abortion also so many drugs were there. So that's why. So this is another important one. Now, so here what I stated that one, the homeopathy is a very vital role. Why? Because so it is a holistic and individualistic science or therapeutic system. It assures the woman's life entire, not only general life, during the entire life in all stages of pregnancy. So either it may be antenatal care, it may be a postnatal care, or after parturition, whatever the issues are encountered or resulting. So there is a very good results were given by our homeopathic system when were used according to the similar principle in the right way, in the right situation. Definitely we are providing, we will see wonders by using our homeopathic into the patient. So initially it plays an important role in the increasing. So if you read the calcarea carp, so it has very good ability to promoting or increasing the conceptive capacity. So generally, so conceivable capacity those individuals are having, but whoever not having or less capable to that one, so it has increasing the capability. So many remedies were used to remove the infertility in male and female. So we will discuss later. So the calcarea carb is used in many cases. Similarly, natrum pos, one more drug is there, natrum pos. You read natrum phosphoricum, it has the ability to increase the conceivable capacity. Similarly, borax, it is also another drug. So symptomatically, they are indicated during pregnancy stage. Again, either maybe heartburn in a case of heartburn, or in a cases of there is a itching in vagina, burning in vagina. In those conditions also are lucarial conditions. In those conditions also, these are the drugs were indicated. But so those drugs are enhancing or increasing the why homeopathy is needed for management of pregnancy means pregnancy is not a simple one. There are so many changes, either physiological changes or psychological changes, or not only organ wise, so many changes in the mammary gland and the uterus or ovaries. So as a physically there is a shape, so many changes, and psychologically also there is but those individuals are not adapting to that changes, physiological changes. They have developed so many fears and psychological impact. So homeopathy is the only therapeutic method to balance and body and mind. So as by a individualistic or holistic approach. So that's why this is only a wonderful therapeutic method to balance those physiological or psychological balance during pregnancy. In all stages of pregnancy, homeopathy can do wonders in providing healthy mother and healthy baby. So through a safest procedures. So most of the case, if you read calophyllum, it like a oxytocin in homeopathy. It promote the most of the thing in normal labor process. So like that cuprometallicum is there, simicifuga is there, so belladonna is there, rizidos. So when you are administered those drugs, it promoting the progressive nature of the pains and the dilatation of the cervix and easily facilitate that one. So normal labor. So except in certain cases there. So similarly, in the prenatal care, generally in the first trimester, so in the prenatal care, what are the common issues? What I already discussed this one. So either what is the role of homeopathy in prenatal care? Means it has balancing the balancing the health and promote the healthier pregnancy. How it providing a healthier pregnancy means to increase the absorption of the certain elements which are essential from the construction of that baby or uterine or other tissues in that one, and also to remove the malabsorption and promoting the healthy tissue construction in the baby as well as mother. So that's why there is no need. So along with the natural, normal balanced diet, our homeopathic promoting can do this balance in the physiological or psychological. So this is another important. So if you take any pathological condition, what is the role of homeopathy? Whatever the in the hypertension or in anemia in play, so many drugs were there in your Medramedica. China is there, Ferromet is there, Merxol is there, Plumomet is there, Cyclamen is there. So Ferropas is there, Magnesia Pass is there. So many drugs. Even Palestella is there. All other things. And also homeopathy is the safest system. There are no contraindications using of any drugs except I read many times I heard should not use Palestilla in early months of pregnancy like that. I studied in certain what exactly why they have stated they are stated like that I don't know exactly, but I never used Palestilla in early months of pregnancy. So because but unfortunately used that Palestilla in certain cases. So symptomatically, nothing happening. I am not observing any bad thing, but most the Palestilla can do wonders in the later month, especially last month of pregnancy. So it has ability to promote. If you read Kent Medica, so a crisscrossed fetus come into right direction after administration of the Palestilla within 5 minutes. This was the statement is there in Kent Medica. See how wonders by see. So before I have used in the early stage of means at the end of 8th month or starting period of 9th month. So why? Because before engagement of the fetus in the pelvic brim inlet, pelvic inlet, so I used this Palestilla where the malformation or malpresentations are there, especially cord presentation, breech presentation, or like the different types of presentations are there, face presentation. So in most of the cases, there may the chances to correct that malpresentation and come into the right presentation, it facilitate easy delivery or normal delivery. So this is another thing. So similarly, the changes like eclampsia, convulsions, or hypertension is controlled if you treated. So even allopathic drugs were failed to control the hypertension. Most of the cases are leads to toxemias of pregnancy. So a number of people were losing their pregnancy, lost their pregnancy because of uncontrolled hypertension. So I used many drugs. Even fortunately, I have gifted some gynecologists helps to me to promote when their system fails. They have referred to me and used those drugs for controlling. They are instructed me. I used according to their instructions, according to their symptomatology. I used some therapeutic agents administered to those patients and take the opinion of gynecologists. They have given a very good response. Very good. Even personally, in my wife has. I have two children. Two children are purely under the homeopathic care. I never allowed to use any vitamins or progesterone supplements, all other things, drugs, except TT injection. Except TT injection. So I acquaintance with my gynecologist. I talked with. She has allowed me whatever the abnormality she has observed and instructed. This is the condition. This is the pathology. Is it any therapeutic agents there? Please go. So but my wife hasn't underwent a normal delivery because of cephalopelvic disproportionate. And even in personally, I have to observe each and every drug action. So in presence of gynecologist, in a personally in a case of my wife. So how the pains are not progressive. I used so there was no pain progressing. The opium is also helpful. Or simcipiga is helpful. So these are the arnica is very helpful. During that stage, patient has developed fear and anxiety, gelsimis is very useful. I used the drug and completely nullifying. 2 days I have to completely sit just beside to the bed and use the drugs and keeping a repertory beside him, beside to her, and I was referring and I was administered. So in lastly, she has done ARM, artificial rupture of membranes. She stated that one, there is a cephalopelvic disproportion is there, what I can do. Yes, ma'am, there is no possibility of cephalopelvic disproportion. It is a mechanical obstruction. You go to the cesarean section. Yes, definitely. So, but the healthy baby was there. So this is a fortunate thing to me. I have observed in under the supervision of gynecologists how our homeopathic drugs are working. So in the most of cases, so many patients, there was no chance in allopathic mode. They are come to either it may be what are the so many symptoms which were mentioned in our repertory. The other systems are not having proper drugs for these. Even they have drugs, they are contraindicated to administer in these cases. What are they? The body manifestations, especially like weakness or headache, vertigo, and pain in various parts, pain in mammary gland, pain in chest region, pain in abdomen during pregnancy, pain in rectum during pregnancy. Capsicum is there, very good drug for to prevent the pruritus or pain in rectal or urge for stool, or constipation is there. Constipation during pregnancy is there, diarrhea during pregnancy is there, and paralysis, paralytic weaknesses in various parts. So paralytic weakness of the bladder, paralytic weakness of the uterine musculature, so many conditions. So urge for urge incontinence. This is a very even surgical procedures are fails to rectify this urge incontinence. But our homeopathy causticum is there. Our retention of urine, she is unable to pass the urine because of enlarged uterine cavity, because of pressure in gradient of fetus. Not in all cases, in certain cases. Maybe a causticum is there, arnica is there, and aconite is there, and plumum metallicum is there. So like that, so many drugs were there in that. Again, sometimes the excretion of albumin, it causes, there is a loss of hypotension has developed, or sometimes oligohydramnia leads to oligohydramnia. So many complications. Or whenever you have to observe albumin in it causes, leads to pedal edema, all other things. So many drugs were there. Sometimes palpitation has developed, palpitation of the heart during pregnancy. Argentum met is there, conium is there, lilium tic is there, natromur is there, sepia is there, like that. So so many disturbances in the mind and physical, or sometimes because of hypertension, convulsions are developed, or protein loss is there. Some they have administered some albumin serum is administered, but unable to rectify, and it may leads to the death of the baby, even death of the baby also certainly. So itching in various parts, they have used citizen, all other thing, allergic rhinitis, bronchitis. In those cases, the cough syrups are contraindicated. Large doses of medicines are contraindicated. They are referring to choose any other medicine or like that. Whoever close acquaintance with me, they are referred to me. Even gynecologists referred in those conditions. Sometimes bleeding gums has developed, mouth ulcers are developed. Sometimes stiffness in the body is developed. These are all chronic conditions like chronic rhinitis, chronic bronchitis, asthma. So those conditions are there is contraindication of uses of steroid in those conditions. They are unable to manage in those conditions. They are come to our homeopathic. There by a chance. So I have to use our drugs to nullify that one. So similarly, in a case of loss of puerperal sepsis, puerperal mania, or septicemia, pyroxenim is a very good remedy for septicemia. So calophyllum is also very good remedy. Belladonna, tremonium, hyoscamas, these are all. Even delusions are developed. So there is a sabadilla is there, pseudocysis or pseudopregnancy, or lycopodium is there. The fetus may be like somersaults in the abdomen, or like some organ, tuja is there, some live animal is there like that. So there are so many delusions are developed. Sometimes lack of movements, they are unable to felt the movements of the baby are like that. So all above mentioned conditions, whatever I have mentioned, there was no proper treatment in all other. They are managing insufficient techniques, all other things. So the patient was feel or bear it to develop the resistance. So these are all. But by God's grace, we have so many therapeutic agents are there. So some people are, God's grace, escaped that painful condition. Some people are bearing the pain and they are leads to attaining the delivery. But our people in our homeopathy, same so many remedies are there for each and every complaint. What I have mentioned here. So if you refer your repertory or Medica, there are. So certain consequences are still continue even after delivery also. After parturition, backache is still persisting, or hair falling is there. I am unable to do. Calicorb is a very good remedy for many ailments which are resulting parturition. Arnica is very good remedy for even postpartum hemorrhage or antepartum hemorrhage. So what I stated that one, opium is very good remedy. Crotalus aridus is a very good remedy for that. So this one. So here, postpartum ailments also, retained placenta, sabina is there. You have to administer sabina or sickle they has ability to eliminate the retained placenta after or partial expulsion of that one. Or sometimes along with that one, uterine inertia. So there is a lack of weakness, paralytic conditions of the uterine musculature coming down. There is a plumomet is there, calophyllum is there. So many remedies are there. This paralysis of the bladder or paralysis of the uterine musculature. So mirror. So same thing I have been observed not only myself, true homeopaths and homeopathic lover patients or whoever loves homeopathy, they are sticking to that one. They take permission of a gynecologist and stick on to that one. And every homeopathy has treated common issues, but not up to the last stage. Certain drugs were there in the first stage of labor, second stage of labor, third stage of labor. This, if we want to observe these all stages of action, we are unable to that one. So in the supervision, why? Because we don't have such cases. We are not having chance to observe. When we are acquaintance with allopathic gynecologists, then only possible to observe and we can do justice to the patient. So the integrated concept is right concept to do more justice to the patient, in my opinion. So certain factors compelling pregnancy, especially fibroid. So fibroid, because of fibroid growth obstructing the growth of the fetus causes, there may be a chances of abortion or lack of growth of the fetus. So our drugs, phosphorus is there, calcarecarb is there, lycopodium, lacasis, these are the kind, when you are using according to the series, they are nullified. The fibroid growth is reduced and promoting healthy pregnancy in that one easily. So the homeopathic remedies are having capacity to change the abnormal presentation of the fetus. I already stated. In Kentimetra Medica, it was under Palstella, it was mentioned clearly. So homeopathic role is very crucial during labor process. It promotes safe labor, prevents labor complications, helps in progression of true labor. Palstella is a very good remedy for to prevent the false labor pains. And simicipiga, opium, these are all. So to reduce the rigidity and facilitate the hormonal balance and easy facilitation of labor process, to cut down the shortness of the labor process also possible by using our homeopathic drug, either calophyllum or palestilla. These are all the, so through which understanding the patient condition using similar remedies, otherwise we are complicated. If you are not thorough understanding of the patient and you hadn't thorough knowledge in Medica, we are unable to treat those conditions. When you are not having these two things, you don't touch the patient. Why? Because if you are not doing justice, if you are doing something wrong, you are complicating the patient. So that's why we have used the weapon carefully. Otherwise, it may endanger us to the life. So homeopathy is a great science when you have understood. So the approach is same. Everybody has what I was stated. General patient was studied as a symptomatic or miasmatic or constitutionally, but artistic approach is different from person to prescribe. It depends on prescriber. Each homeopathic practitioner, they are approaching, they are using their skillful knowledge in a different manner. Ultimately, they are succeeded. So the art is never stolen. You have to habituate. You are acquired by knowledge. You are treating more number of cases and other things. The homeopathic constitutional approach so proposes a disease as arising out whole physiological and psychological. If you are treated, if you are using miasmatic remedies during pregnancy, there is a possibility to restrain the hereditary tendencies. This constitutional and miasmatic approach could prevent hereditary tendencies and to prevent the habitual abortion, to promoting the uterine musculature strengthening and all other things. So some certain remedies like sickle and sabina has ability to clear the conceptive products retained in uterine cavity after abortion. And Plumomet helps to provide a space. Sometimes there is a lack of room in that one. There is no space to the growing of fetus inside of the room. Patient is feeling like that. Plumomet is the remedy. So I already stated Palestilla is ability to change the position of the fetus before that. So pregnancy is a separate chapter or subrubric level. If you see the repertories, various repertories, so it may be a chapter is there or subrubric level is there in each and every chapter. So under the main rubric, and also in Metramedic, each and every drug where the drug has scope in which stage of pregnancy clearly mentioned. When you thoroughly studied, maybe a urinary aspect or mammary gland aspect or increasing the milk production or puerperal sepsis or puerperal convulsions or like that. So everyone knows the remedies which are using commonly, laconite, belladonna, apis mellifica. I no need to explain that one. This was the table I have administered in most of the cases. So I used. So as any symptomatology is there, I go to according to the symptomatology. But as in my observation, in the most of the cases, the remedies, the indicated observations come or suggest to this remedy. First month, Viburnum apple, second month, Sicalcar or Sabina, third month, Apis mellifica, fourth month, Simsifiga, fifth month, Sepia, sixth month also Sepia 1M, seventh month, Ruta, and eighth month, Opium, ninth month, Calophyllum. So as miasmatically, I started from second month onwards, the calcarea carp. Most of the thing, weekly pregnancy positive is there. There is no proper active movements in the fetal pole. I used n number of cases, calcarea carp, it develops. So the allopathic people are suggested to abort. There was no active fetal movement. So there is a need to abort. So in most of the cases, within 2 weeks of time, I succeeded 50% of cases with calcarea carp. It has developed ability. So that's why I started calcarea carp business. So medorinum in third month, fourth month syphilinum, fifth month tiburiclinum, sixth month sorinum, and seventh month solum. So there is no need to continue further miasmatic treatment after that one. So in the most of the cases, it is also another very important case in my practical experience. That lady was advised to don't go to the pregnancy. Why? Because she has a pulseless disease and some other comes. We are unable to holding the pulse and other activities. It's a very difficult to pray that one. So if you read that one, it is purely there in Telugu. She was developed severe depression and other thing. I treated this case and now she has delivered two children. The children, two male babies, healthy babies. Even the lady has normal deliveries. Normal delivery. Both are normal deliveries. Both the boys is about 10 years and 12 years in that one. So this is another important. Our homeopathic doctor. So she has also developed so many issues during pregnancy. I have so many videos are that, but unfortunately to get it that one in another thing is there. So I advise it to my students also, whoever qualified or learned from me, and personally how to use first. Later you have to use for your patients are like that. They are stated that one is because of this Viburnum apulus or some other. This is a little bit so many on each stage. What are the drugs indicated? I collected from other sources. So almost the common drugs were there, other things. So this is another important one. A homeopathic doctor has heightened levels of prolactin levels are increased. She is unable to conceive and she has developed thyroid problem and rheumatoid arthritis. They are advised to abort it or like that. But I suggested don't go to the abort process and used homeopathic drugs, all other things. And she has developed. She is also given birth to two children. Their age about 5 years and 7 years are there. So with normal labor. This is a very fortunate thing. So with that. So that's why I concluded I have treated nearly 500 cases in my experience. Out of a few cases are underwent a cesarean section and remaining are normal delivery. So these are all what I have mentioned earlier, the same problems. So, but what I have suggested is without the acquaintance or supervision of allopathic people, we are unable to manage. Even Staph aureus is there, episiotomy in cases,
Brilliant.
Yeah.
Because
okay.
The great teacher, the great practitioner, Dr. Karunakar explained a lot on this, how homeopathy can be employed on this. And we need to hear from you more from you, sir. But the time is now, we finish.
Okay, sir. Thank you, sir. Thank you.
We need to share our time to Malayalam. So next time we will meet again. On behalf of IFPH, I thank you, Dr. Karunakar, for the excellent session you had. And thank you for all who are here, who presented for the session. And now it's time.
Okay, sir. Thank you.
Okay, thank you, Doctor. Thank you. Over to Dr. Shaila.